The first 24 hours after a baby is born are some of the most important hours in that baby's life. And a lot of newborn problems can become serious quickly if basic care is delayed or missed. So if you are a mother, a family member, a student, or a healthcare worker, this is something you should know clearly. Newborns are adjusting to life outside the womb. They need warmth, they need feeding, they need observation, and sometimes they need urgent support very early. In many real-life settings, especially where access to care may be delayed, these first steps matter even more. That is why essential newborn care should start immediately after delivery. Let's keep it simple. In the first 24 hours, I want you to remember 6 essentials: warmth, breathing, breastfeeding, cord care, observation, and danger signs. Now, let's break them down. First, keep the baby warm. Newborns lose heat very fast, so the baby should be dried, placed skin to skin with the mother when possible, and wrapped well. And this is important. Do not rush to bathe the baby immediately. Early bathing can make the baby cold, and that is not safe. Second, make sure the baby is breathing well. If the baby cries and breathes well, that is reassuring. But if the baby is not breathing poorly, grunting, or knocks blue, that is urgent. A skilled health worker should step in immediately. Third, start breastfeeding early. If the mother and baby are stable, breastfeeding should begin as early as possible, ideally within the first hour after birth. And that first milk colostrum is important. It is not dirty, it helps protect the baby. The baby does not need water, glucose water, herbs, or other feeds first. Breast milk should come first. Fourth, keep the cord clean and dry. The cord should be cut with clean equipment by a trained person. After that, it should be kept clean and dry. Do not apply toothpaste, ash, powder, balm, hot water, or herbs to the cord. That can increase the risk of infection. Fifth, observe the baby closely. Do not assume that because the baby has been delivered, everything is automatically fine. In the first 24 hours, watch the baby. Is the baby feeding well? Breathing well? Warm? Active? Does the baby look unusually weak, limp, or unwell? Sixth, know the danger signs early. If the baby is not feeding, has fast or difficult breathing, fever, lower body temperature, convulsions, looks very weak, or develops yellowing very early, the baby needs urgent medical assessment. Do not wait and hope it will pass. Act early. Now, for students especially, do not just memorize this as a list. Understand the reason. Warmth helps prevent core stress. Early breastfeeding supports nutrition and protection. Clean cord care helps prevent infection. Observation helps you pick up problems early. That is why this care matters. So let's recap the essentials: warmth, breathing, breastfeeding, clean cord care, close observation, urgent help if danger signs appear. The first 24 hours matter, and simple care can make a real difference. I met Nurse Mira, that nurse who turns complex health knowledge into simple, practical, student-friendly, and public-friendly content. If this helped you, save this video, share it, and follow or subscribe for more. Comment newborn care if you want part 2 on danger signs.